Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pathological gynecomastia. Pathological gynecomastia, if the growth of the breast tissue occurs due to some diseases, then it is pathological gynecomastia. Causes of pathological gynecomastia. One, it can be idiopathic in nature, which is the most common cause. It can be due to the relative estrogen excess because of increased estrogen excess when compared to testosterone, or there can be absolute estrogen excess. Truly, the estrogen may become more in both these conditions or due to drugs. So, these are the four different causes of pathological gynecomastia. First, relative estrogen excess. Conditions where we see relative estrogen excess include, so relative estrogen excess is seen in here. This relative estrogen excess occurs due to the failure of the testosterone synthesis. When first of all, if there is testosterone is not synthesized properly, or if the synthesized testosterone cannot act properly because of some receptor resistance, in such cases we see that there is decreased testosterone, and even the normal amount of estrogen will become more than normal because of less testosterone. So these relative congenital estrogen excess is seen in congenital defects like in anarchia, where there is absence of testis. If there is absence of testis, then there is absence of testosterone. Obviously, because of absence of testosterone, the estrogen which is present in the body will result in gynecomastia. In Klinefelter syndrome, there is atrophied testis is seen. Because of this atrophied testis also, there is absence testosterone. Because of absent testosterone, relatively estrogen excess is seen. Then androgen resistance. Here the testosterone is completely normal, but the testosterone cannot act because of the resistance of the receptors. Like we have testicular feminization syndrome, or in testicular feminization syndrome there is 5 alpha reductase deficiency, so testosterone cannot get converted to dihydrotestosterone. So as a result, actually dihydrotestosterone acts on different parts of the body, resulting in the action of testosterone. So because of non conversion of testosterone to dihydrotestosterone, so it cannot act on the receptors, so the action of testosterone is not there, and as a result the patient will have estrogen excess relatively. Androgen resistance is also seen in Riemenn-Feinstein syndrome also. Then there can be some defects in the testosterone synthesis. If there is any defect in testosterone synthesis, then testosterone is not synthesized. Obviously, there will be relative estrogen excess is seen. These are congenital defects. So now if you see the acquired defects of estrogen excess. Acquired defects of estrogen excess, these includes one, it is secondary testicular failure. It is also, these acquired defects are called as secondary testicular failure. So these include, it can be viral orchitis where there is infection of the mumps infection to the testis. So testis is damaged, so there will be no testosterone. There can be trauma to the testis resulting in uh, injury to the testis, so decreased testosterone. Or castration, if someone has, if testes are removed or the patient is castrated, then obviously there will be no testosterone. In leprosy, there can be testis atrophy can occur, or it can be due to myoclonic dystrophy, or in spinal cord disorders, or in renal injury. All these will result renal failure. All these will result in testicular failure, resulting in relative excess of estrogen, leading to pathological gynecomastia.
thank you and thank you for watching.